Okay. Thank you very much, Biljana, and welcome to everyone. Thanks for participating today. So that was a very nice lead-in to what we're going to be talking about today. So if we could just go to the next slide, please. I just wanted to say, first of all, that this slide set that I'm going to present today is part of a larger slide set, which is fully CEPA accredited, which our group put together. So if anybody wants a copy of the slides after we're done, the full slides, there's actually about 90 of them with some cases included. You can email me at the email that's shown on the screen there. Okay, so today what we're going to talk about is non-adherence, specifically in the breast cancer patient population, mostly focusing on the adjuvant breast cancer patient population. We're going to talk a little bit about what the scope of the problem is. We'll get into some of the reasons in terms of why we think patients might be non-adherent to their medication, what the consequences of this actually are, and there is some research into this. And finally, we're going to talk about how we can help our patients become more adherent. So what is the scope of the problem in terms of adherence? Well, if we can just go to the next slide, this is sort of borne out, I think, in the opinions of the poll that we put together before the webinar. But we all know as pharmacists that adherence to oral therapy in general is a common problem. We have a very difficult time getting our patients to take their oral medications properly, and it certainly is worse if patients are on more complicated medication regimens. But even in uncomplicated regimens, it is still a problem, and clearly there's some confusion and misunderstanding that occurs with patients. And the paper that I quote here at the bottom was from 2002 from the Journal of Oncology Nursing, and this was actually not just oncology meds, but all meds. And in this study, only 30% of oral medications were taken correctly. So you can see that that's quite a disconcerting number. The real number in terms of adherence in general is probably a little bit higher than that. This is one paper, but still it kind of points to the fact that this is a problem. Okay, so we also know that oral therapy in breast cancer can take a few different forms. We know that it's mostly hormonal in nature. So we have patients who obviously are on estrogen manipulations such as tamoxifen and aromatase inhibitors. But of course, we now are seeing oral chemotherapies being used like capecitabine in metastatic breast cancer, and an increasing array of targeted therapies such as lapatinib, which are also oral. And of course, this is not going to change. This is going to continue to be a growing problem because we have certainly a number of TKI oral therapies that are coming down the pipeline. As well, we may be seeing PARP inhibitors down the line, which are oral therapies. So this is something a problem that's going to grow in scope as we move forward in sort of developing new treatments. So just some facts and figures really quickly, because I think that it sort of behooves us to look at this. These are American facts and figures, actually. The numbers are a little bit old, but they're from 2006 from the American Cancer Society. But in 2006, 2.3 million women in the U.S. had breast cancer. About 1.3 million of those may be postmenopausal women with estrogen receptor positive disease. And so obviously these are the women that would be affected by compliance or adherence problems because they're the ones that are going to end up on oral hormonal therapy. And for 2/3 of these patients, a 5-year course of adjuvant therapy will significantly reduce the rate of recurrence and increase survival. So a lot of these patients are going to end up on these therapies. Now, and of course, this actually plays a little bit into what we were talking about with the questions before the webinar. It is tempting to think that breast cancer patients will be a particularly adherent population, given how serious the disease is and the fact that, especially in the adjuvant setting, you can prevent it from recurring. However, and here's a question, and we kind of asked this question before. What percentage of early breast cancer patients on adjuvant, this is specifically in the adjuvant setting for hormonal therapies, do you think adhere to therapy? And there are some numbers here, and we'll go to the next slide. There was a recent study that showed about 75% of patients were adherent just in year 1. So you think about that, that's 25% of patients that are dropping off already in the first year of treatment, and that's quite significant. Some more numbers. Compliance with hormonal therapies. This was actually looking at hormonal therapies in general in a publication in The Lancet in 1998. And you can see that The studies have shown that patients may reduce their risk in increasing numbers as you take your hormonal therapy for longer periods of time. And this sort of ties into what we're going to talk about later when we talk about the impact of non-adherence in this population. So this is a study looking at adjuvant tamoxifen that was done by Partridge and published in the JCO in 2003. And you can see these are also very sobering numbers. At year 1 in this trial, 83% of patients were considered compliant with their medication, and at year 4 that dropped to 50%. So we know that patients, and we know this from various trials, that 5 years seems to be the magic number in terms of tamoxifen. That 5 years seems to be that length of time that patients should take the therapy for optimal efficacy. But 50% of patients have dropped off by year 4. So how do we know that 5 years is better for most patients? And of course, this is based on an idealized clinical trials population and not necessarily on the real world. Some more numbers. This is from Cancer in 2006, and 2,816 women with tamoxifen as initial hormonal therapy. Only 31.4% of women stayed on tamoxifen through the end of follow-up, and the cumulative non-adherence rate at 3.5 years was 35.2%. So again, very sobering numbers. Looking at anastrozole, so moving into the AIs now, this is another Partridge trial that was an abstract at San Antonio in 2006. And this is about 15% of women, and you can see the numbers are very similar. About 19% patients were non-adherent in year 1, and by the end of year 2, you had 32% who were non-adherent. And some staggering figures from the Compliance Strategic Initiative is an initiative in the United States that's led by a number of different bodies in the U.S. And they found that after 4 years of hormonal therapy, compliance decreased to 50%. Tamoxifen adherence, 17% of patients stopped taking the drug during the 2-year follow-up, and of these, 68% of them stopped after 1 year. And 55% reported non-adherence either occasionally or frequently, and often intentionally.